Hello, my friends all over the world. I'm happy to be posting something every day for the next week or so, and it's all about the principles of movement system impairment syndromes. So for all of those physical therapists and movement professionals out there, I hope these daily posts is useful and worth your time. Today's talk point is that the way we do everyday activities really matters in how we feel, both in the short term and long term. Now, I'll use myself as an example. This is a really good example. I used to have this left groin pain since last year that lasted through earlier this year. It got so bad to the point that just getting in and out of the car from the passenger side caused excruciating pain. And I'll show you how I earned this pain in the left groin. This is the big reason why. Ready?
Yep.
Okay. I'm shaking my head because it's just so obvious. Now, some of you may know I've been a physical therapist working at this wonderful clinic called CPRX since 2005. So that's nearly over a decade of being lazy about going to grab the towels to put under my patient's elbow whenever I assess their shoulder rotation movements in supine. Which leg did I use to support my patient's elbow? Of course, my left thigh. So I also have a bad habit of standing with a sway back posture, which then puts anterior directed stress to my hip. And since I've been working on avoiding that excessive hip flexion medial rotation position and avoiding sway back posture, I've also been doing some appropriate hip exercises. I'm not feeling the sharp hip pain anymore. My goal is to be strong enough so that I can get back to playing tennis without the hip pain. But I guess first I gotta figure out my time efficiency so that I can actually get to the tennis court. You see, it's not the one time of doing that movement was a bad thing. Say, for example, if I eat a brownie today, the chance of me getting diabetes today is low. But if I continue to eat that brownie every single day, my chance of getting diabetic would be high. So it's the not optimal movement that we do every day that's going to eventually lead to pain problems. So my physical therapist friends, please join us in Torrance, California this August for this amazing 4-day course to learn about how to precisely assess the movement system with highly experienced lecturers and lab assistants. Please check out the Nexus Motion website for more details. And look for the next video tomorrow. So we'll see you then.